Hello, everybody. Welcome to the show REABSORB, a show by NephroPlus on the history of Indian nephrology. And the lens we're going to use to look back is the reflections of people who actually created history. And on the show today, we have Professor Thomas Mathew. It's an honor, sir, to welcome you to the show.
Thank you. Thank you. Thank you very much.
And to introduce our guest to the show, let me take a couple of minutes, or maybe more than that, maybe. It's truly an honor to introduce him. Professor Mathew did his MBBS in 1968 from Calicut Medical College, a time I guess a lot of the listeners may not have even been born. I was just about born then. And then he had an illustrious undergraduate course, as we learned.
Yeah.
He aced and got gold medals in pathology, obstetric gynecology, and medicine. And I think in med school, a single gold medal is very coveted.
Mm-hmm.
And then subsequently, he completed his MD internal medicine from Trivandrum Medical College in 1972, and went on to do his DM nephrology at 1974 in PGI Chandigarh. Sir, were you among the first who did the program at DM at Chandigarh?
I'm the first in Kerala state. I'm
Okay.
the second student of nephrology in the country.
So I think that speaks volume of itself where Professor Mathew stands.
Right.
And he then moved on to serve his entire professional service in the Kerala Government Medical Services at Calicut Medical College. I don't think it's just about that. It's the fact that illustrious firsts he holds behind his name. Other than being first fully qualified nephrologist from Kerala, he started the first fully fledged dialysis center at Calicut Medical College in 1976, the first of its kind in the Kerala State Medical Services. He, in 1985, in collaboration with the urology department, he started the first renal transplantation program in Kerala, and subsequently went on to start the CAPD program also at the same college, again a first in Kerala. And mind you, Calicut is not the head of what you call the capital of the state, so it speaks a lot for the perseverance and the determination of Professor Mathew. And then subsequently, as the need of the time, he went on to set up the first intensive care unit for snakebite poisoning, which is a rarity for modern trainees in urban centers. But that's what nephrology demanded, and that's what Professor Mathew delivered. We'll talk later in the show on his seminal clinical contributions, and a very, very interesting anecdote is the fact that he described the tongue sign of uremia, which we'll talk about, and he had special pathological descriptions of snakebite complications, including papillary necrosis and adrenal hemorrhage. He was also one of the persons who described glomerular changes in leptospirosis, which I learned as an undergraduate, subsequently in postgraduate. Quite appropriately, he's been recognized by several organizations for his contributions. To name a few, in 1996, the Kerala state government awarded him with what is called the Good Service Entry and also the Best Doctor Award in Kerala state. Truly an honor. Congratulations, sir. And beyond the state, he also has had a lifetime achievement for the Association of Physicians of India, what we call the API in medical fraternity. He got the Best Doctor Award from the Indian Medical Association. In addition to that, the Mathoma Syrian Church honored him with the Manaseva Award in 2011. And Tanko Foundation, which is a leading NGO in kidney care in South India, also awarded him with a Lifetime Achievement Award. If I were to describe Professor Mathew, what I have known him, he's very serene, positive, humble. I think I'll leave it there and welcome you again to the show, sir. Any words from you before we kind of jump into the, I don't want to call the Q&A, the interaction? Anything from you?
Good.
As you reflect back at your career, is this something that
Right.
fulfilling? Was it a fulfilling? Very much.
Very good.
Okay. All right. So maybe let's start back to when it all began, sir. How was it entering medical school? Was it a dream all your teenage years, or otherwise? How was this? Is it an accidental entry?
Yeah, because from childhood onwards, I had the intention to become a doctor.
Okay.
Because we had 2-3 family doctors, they were role models from the time I entered the school. I didn't have idea to go for any other subject rather than medicine, right from the school days. So I'll still remember my cousin, Dr. Mathew Roy, who was a professor of endocrinology at Formative Medical College, and he was a role model. He's my first cousin. So from school time onwards, I was intended to become a doctor. And my parents also agreed to it. And I went on studying without any lapse in between. And not only studies, I used to play football, basketball, hockey, and I was in the Indian Scouts, and had a busy time in the school. And the school education was over. Then the college education started at Calicut.
Good, you didn't have gadgets then. You didn't have any gadgets then, so you could spend time between the ground and studying. That's good.
It's continuous, and then after the school, at that time it was pre-university. It's a pre-university.
Yes, I know that. Yeah.
1 year course. In the pre-university, the selection is all by marks. There is no NEET examination or anything. So if you got the first class in the pre-university, you get automatically selected for medicine course. Because you have a choice. Those people want to go for engineering or veterinary or Ayurveda can go for that. But my preference was, of course, only medicine. So I got into medicine. And then we have 1 year of pre-medical studies.
Yeah.
Before entering the medical college. Now,
it got phased out when we entered.
Yeah, I did that in the Union Christian College at Alway. And then I finished that and came over to Calicut and started the MBBS course in 1963. Remember, many years ago, 1963. And finished the course in 1967. I thoroughly enjoyed the course because I was keen to know about the human body, know about the illness, and how to correct the illness, how to deal with patients. And my teachers were very good people at that time. They were very empathetic professors of medicine, surgery. So they took us into a realm of medical teaching as well as a realm of patient care. So it was very good to understand that from those people, and we have imbibed a lot of their nature, their attitude, all have come into our activity. So we used to emulate the teachers.
Osmotic learning.
Right. So automatic learning, and then almost like a Gurukulam training, at that time. Gurukulam training. We walk with them, go with them, see the patients, and then discuss everything, and joke, and then stories, and so many things. Nowadays, you don't study history of medicine. During our time, any disease, we start the history of that disease. Who detected that disease? Where was it? How the medical treatment came into that particular disease. Now it is not there. You all go for
history of medicine. Yes,
Google and get there.
I have to.
So the training in medicine was superb. So I passed the MBBS with the first class in 1967. Then 1 year of house surgency. House surgency were a tough time. You have to take 24-hour duty and sometimes 3 days altogether, and then give the injections, put in the catheter, put in the, all sorts of aspirations and the liver aspiration, pericard. Now you can't go and do a pericardial aspiration without the monitors and without the cardiologist seeing it. At that time, a doctor is a jack of all trades. An MBBS doctor is jack of all trades. And so we learned all that by hand-on experience. And then the choice is to go for post-graduation. So
what tilted you into nephrology? I wanted to interrupt you. What tilted you into nephrology?
So I went on to general medicine at Trivandrum Medical College, and I finished the course in 1972. And I was about to go to the US because I have already got an appointment in the US in New Jersey in one hospital.
Wow.
Yeah. So I went to my professor, Professor K.N. Pai. He's Padma Shri Professor K.N. Pai at Trivandrum Medical College. I said, sir, thank you very much for the training which you have given. So I've got an appointment in the US. I'll be going. Please bless us. So Professor asked me a very pertinent question. Dr. Mathew, what are you going to do in US? I said, to practice, to learn more things. And then he said, and what? And treat the people there. Then he asked a very pertinent question. So you are going to treat the white people? So what will happen to people here in Kerala? You all go abroad and treat the people there and you get some money. And what happened to our patients? I was startled to listen to that. I said, why, sir? He said, there are no people, no doctors to treat here, especially kidney disease is one disease. There is no treatment at that time.
Wow.
And
So,
yeah, in 1972,
no, but
they
is
birthed
that so?
nephrology. Pardon?
The trigger came from so the trigger came from your professor of medicine.
Professor. He said the word of nephrology was not heard.
Exactly.
In the textbook of medicine, there's only one chapter on kidney disease, one chapter on sudden kidney failure, and one chapter on chronic kidney. That's all, 3 chapters. He said the nephrology has advanced so much abroad, but nobody in the country. Then I said I will ask my father because I have to go to US. I've already ticket, everything is ready. Then I told my father that this is what my ambition is to go abroad, but my professor says that you are required here in Kerala State. So father said, your teacher is the best person to give you the direction. He knows you for the last so many years. He knows your aptitude. He knows your ability. So what he says, you listen to him. We are happy where you are.
America's lost, India's gained.
Yeah.
Yeah,
and
truly.
then where to get the nephrology training from? That's the problem. So I asked Professor Pai, where can it? He said, I do not know. He said,
Oh
he
my
do not
God.
know where training is available in India. He said, he has heard about the postgraduate institute, and there's one Sardarji who is a professor of nephrology.
I'm not going to ask the name.
Yeah. And then if you can get some information from him, how to get information in Trivandrum from Chandigarh, there's no internet, there's no cell phone. So I found out that there was one doctor who was passed out from PGI on gastroenterology, Professor Balakrishnan. So I met Dr. Balakrishnan. Yeah.
Was he?
Dr.
Okay.
Gastroenterologist, Trivandrum.
Okay.
So I asked him, he said he's also not aware of who's doing nephrology training. But he said, if you write to Professor Chuk, he might give you some information. As a small boy after MD, how can I write to a professor of nephrology? So I asked Professor Pai, sir, will you contact Professor Chuk to see if he can give a training for us? Professor Pai did not have any hesitation. He took his letter pad and wrote a letter to dear Professor Chug. Professor Chug is the head of nephrology in PGI Chandigarh, saying that there's a body here. He wants to do nephrology. Is there any facility for training at PGI?
And when was PGI started? Just for our audience,
PGI was started in the 1958, 1960s.
No, the PGI nephrology program.
Nephrology started in 1970.
70.
They set up the department. Professor Chug was working there. He got trained from the UK and he started the department in 1970. But the training course started only in 71. Dr. Amreshan from Chennai.
Amreshan was the first one. I'm aware of that.
He's no more now. He passed away a few months ago. So he was the first candidate. So Professor Chug, we gave the letter to Professor Chug. He gave the Professor Chug, Professor Pai gave the letter to me, asked me to post it. And I sent it as a registered post with a self-address cover in it. Right after 7 days, reply comes saying that Professor Pai, will be happy to take your candidate for the training. And
Destiny was written that day.
And then there was no looking back. I went to Chandigarh and then met Professor Chuk. He welcomed. He said, you can join as a registrar in nephrology and learn medicine as well as learn nephrology. And there was a problem. I said, the salary is very meager. I have a wife and a child. What will I do? He said, there's no problem.
Oh, you're married by then.
Already married. Yeah. Professor Chuk is a person for whom there is no problem. For everything, he'll say solution. He said, Dr. Mathew, don't worry, there's a solution. I said, what's the solution? You work as a registrar in medicine and do training in nephrology. So you get a registrar salary That will be sufficient for you to keep the family. I readily agreed. And then the problem starts. Then the problem started. Registered medicine is a very heavy work in PGI Chandigarh. It's a national institute, and in medicine, all the wards, there's only one registrar who will have with you on his toes all the 24 hours, sometimes 3 days together, sometimes 4 days together, and get all firing from these chief people there. And they don't
And this
speak
comes
English.
after your this was after your MD
And
training.
at the same time, do nephrology also.
How did you manage? How did you manage it?
I could manage. And initially, after 1 week, I thought it's not good to work here. I'll have to go back. I went to Professor Chuk's room, knocked at his door. Then he said, I came back. Then Professor Chuk asked me what. No, I said there was another problem. Then I came back. After another 2 weeks, I went to his room again, saying that I'm leaving because this is too much for me. He said, what's the matter?
My God.
Yeah, so what's the matter? I said, this is too heavy work for me. I can't do both the nephrology training as well as medicine. So he said, my son, don't worry. You will be all right. You are my best student. So you will do very well. Don't worry. I'll be with you. What other confidence a person can give? Then Professor Chuk was a different person thereafter. He was just like a brother, like a father, like a, like everything. So he looked after me so well. Yeah, and then
you recall him very fondly.
I'm sure it was a special relationship thereafter. So all the theory and practical aspects of nephrology could be learned right first-hand information from Professor Chuk. How to prepare the kidney machine, how to start a dialysis, how to make the solution. Nowadays, everything you can buy from the shop, buy from the pharmacy. Right. Previously, we had to prepare the dialysis solution, prepare a machine. Yeah, now the machine is not even prepared. Ready-made, you pay 350 rupees, you get the filter. Now, that was a time when everything has to be done by the doctor himself.
So you were the technician, the nurse, the doctor, everything together in nephrology.
Yes, a fantastic training which he gave us. And then biopsies, kidney biopsies. I've never done a kidney biopsy in the past, never seen also. Professor Chuk said, Carlo, you do it. I said, how to do it? You read the book. So simple. Read the book, and he gave the book and gave me the needles and performed without anybody else. Successfully, more than 200 biopsies in PGI, I did without any problem.
Those were with X-rays and lumbar spine counting.
Yeah, correct. And nowadays you require an ultrasound, you read a measurement. At that time, nothing is there. Blindly, you have to do the biopsy. So we have started from that period to the present state of affairs, which is very superior now. But students do not know how we have gone through this set of training, which has been fantastic training, which we got from the PGI.
Let me digress into some personal aspects. How long did it take for you to travel from Calicut to
Chandigarh?
Those days.
At that time, I had to fly from Calicut to Chandigarh. I went from
you had flights then?
Yeah, I had to, because he gave a short time to join. Within a week's time to join. There's no time to book the ticket for the train and all that. So I flew from Calicut to Delhi, and from Delhi to Chandigarh.
Oh, you had flights by then.
And Chandigarh was a place I have never gone there. It was in the 20th of December. So cold it was, shivering.
Oh my God! Was your family able to cope in Chandigarh? They didn't have problem with
family came back came in at about 6 months after my joining there. We got a flat there and we stayed. And it was a comfortable stay there with good company. Okay. And then the training went on. And I passed out in 1974, 2 years of course. Now the course is 3 years. When I joined, it was a 2-year course. Then after joining and finishing the course, I came to Calicut.
How did you feel when you left Chandigarh? When you left Chandigarh, when you left Chandigarh to come back to Kerala, what were your feelings? When you finished your DM?
I came from a castle to a cattle shed. That's the difference.
That's a very apt description.
I came to Calicut, and I was already a lecturer in medicine before I went. So I joined the lecturer post back in Calicut. But I wanted to start nephrology. There's no way. Nobody had heard about nephrology. Nobody had heard about dialysis. Nobody had heard about artificial kidney. So, yeah, so I met the senior professors. I said, this we have to start. Because at that time, there's a period when snake bites was galore in Calicut and poisoning due to snake bite poisoning, viper poisoning. And every day, 4 or 5 patients would be admitted in the medical college and most of them died. About 80% death was there at that time due to snake bite. And same way, gastroenteritis was very prevalent in the rainy season. Leptospirosis. And also people used to die because of acute kidney injury, gastroenteritis. Then, of course, snake bite, gastroenteritis, all this cholera, everything was there in Kerala. And people were just dying.
At that phase in your life, was there a guardian angel in the medical college for you to get the apartment going?
No way to get things done. So I told my father, I have got trained. Now I can't do anything after coming here. The government is like that. You can't buy a machine just like that in the government service. It has to go through so many processes. So my father said, with his good ideas, he said, meet the press people, news press. And there are 3 important news people here in Calicut. One is Madhrubhumi, other is Manorama, another is Chandrika. They're all very stalwarts in the Kerala scenario.
I'm aware of this.
So I met, KP Keshav, Mr. Rajan Matthews, and all those people. So I got up an appointment with them. I said, I am a doctor trained in kidney disease who can save people with dialysis. Now, so many people are dying here. You are reporting in the paper every day, so many died of snake poison. So we can save them. So they said, it's a good idea. So what should we do? I said, you have to speak to the government, the ministers, and then let them take an initiative to help us to get a dialysis machine so that we can start and save the patients from death. So he said, there are 2 ministers from Malabar. Malabar is this area, The health minister was from Malabar, Dr. Adiodi, and the finance minister was also from Malabar. So he said, these 2 ministers are from our state, from our district.
Our part in the Kerala state government.
When they come to Calicut, we'll have a meeting together. Exactly a week later, they were in Calicut. So Mr. KP Keshav, who was the chief editor of Madhuri, called me.
So that was pretty powerful advocacy then for a young medical person. Very powerful advocacy, like press and then government.
Correct. Very
amazing.
Good. And then I had a meeting with these press people and the ministers. So ministers also had never known about this type of treatment and if people can be saved from death, which was galore in Calicut. I said the death rate can be reduced to 20%.
I wish policymakers listen to CKDU like this nowadays.
So they readily agreed. The finance minister agreed, health minister agreed. Then again, they said to send a proposal to the government to start the department to buy the machines. Once you send the proposal, it takes 5 years to reach the minister.
Process.
So I said, it's very difficult. So then I had my source of refuge was Professor Chug, my professor in Chandigarh. I told Professor Chug, sir, this is the problem. I am the government service. To get a machine, it takes 3 years and my whole training will be wasted. He said, don't worry. He said, don't worry.
Don't worry.
He said, I will send you 2 machines. I will send you 2 machines to start dialysis in Kerala.
My God.
So he got 2 machines for me from US. Without paying any money. 2 machines arrived in Cochin port by ship. Within 6 months, 2 machines came. I brought them to Calicut and got it organized and we could start dialysis. Then people were wonderstruck as to how people are saved from death. From death rate of 70 to 80%, it came down to 25 to 30% of snake poisoning, gastroenteritis, leptospirosis, cholera.
So you had it even before, you had dialysis services in Calicut even before Trivandrum commenced?
No, Calicut only the first one to start in Calicut. Trivandrum started only after 5 years. After 5 years of starting in Calicut. Then there was no problem. Gradually, we got this post of an assistant professor, then the department, then we got more machines. Then the government started purchasing machines.
So I think this is something that I wanted to ask on the show. Like, how is that you were able to influence youngsters, say, your
Yeah,
faculty, to
yeah,
join nephrology? Because I know
correct.
you have a tube
Yeah,
to tell you. What is the magic
youngsters,
you use?
yeah, they were fascinated by this by seeing the dialysis machine. They were
Mm-hmm.
fascinated by how people can be saved from death. All the
Mm-hmm.
medical students. Then I have to give lectures in the IMA, through the television, to the newsprint about the good aspect of dialyzing the patient and saving them from death of acute kidney injury. So that was the time I had to go all around the Kerala state, from Calicut to Manjeri to Palgad to Guruvayur to Ernakulam to Trichur to Trivandrum to spread the
You were
message of nephrology.
you were
Spread
the
the message.
spokesperson for
Yeah,
kidney health, kidney
yeah,
diseases, nephrology,
yeah,
all in one
yeah.
package.
And then, after 2 years, I started the DM course in Calicut was started.
Which year was that?
That was in 1990.
Okay.
1990 we started. 1990. Then people
Hmm.
started joining the course. Now every institution has got now DM course. Now I
Yeah.
started with two dialysis machines and a dialysis center in medical college. Now there are 1,000 machines in Calicut.
In Calicut alone.
1,000 machines, dialysis machines are there in Calicut in 10, 15 centers. And we used to dialyze 3 or 4 people a day in the medical college, start with 1960, 1975. Now about 200 people are being dialyzed daily. So it
Okay.
has from one candle, 1,000 candles have been lit. That type of a situation.
Since, as I introduced you in the show,
Yeah,
and learning that the snake bite has a large role to play in your
right,
early
right,
career.
right.
I mean, can you lead us through your work on describing papillary necrosis and adrenal
Yeah,
hemorrhage,
correct.
which I'm sure
Now,
was very passionate for you too.
apart from the clinical work, I had the intention to do the research work also. That's again training from PGI Chandigarh. In PGI Chandigarh, there are only 7 beds for nephrology. Each bed, a paper is published from each bed. So you can get so much of information
Then to
from
the
one
top
patient. Yeah, from one patient, you can get so much information. So all people who had acute kidney injury, whether it's snake bite or gastroenteritis or leptospirosis, we used to do the kidney biopsy. So far, no biopsies were done in Calicut kidney biopsy. I started the first kidney biopsy in Calicut. And they
Mhm.
gave a host of information which was never in the textbooks, like papillary necrosis, complete hemorrhage in the kidney,
Who reported your
glomerular.
biopsies? I mean,
What?
were there pathologists who were trained to report
Yeah, we
biopsies?
had a good pathologist here, good pathologist in Calicut, Dr. Belraman Nair. He's a very good
Okay.
pathologist. And
Mhm.
so he could decipher all the abnormalities in the histopathology slides. So it was a
Good.
wonderful thing that we could get so much of clinical material and so much of academic material, and which we published. I've already done more than 100 publications in the national and international journals.
Now,
All
there
these
was this
matters.
publication, the papillary
Yeah,
necrosis and the adrenal
yeah,
hemorrhage.
it was there. Papillary
Okay.
necrosis, adrenal
Mhm.
hemorrhage, glomerulopathy in snake
Definitely.
poisoning. Yeah,
Mhm.
and of course, tubular necrosis is well known. And of course,
Yeah.
I was interested in filariasis. Filariasis is
Mm.
very common in this coastal area. The glomerular disease in filariasis also were published by me. Glomerular disease in filaria,
Okay.
filarial nephropathy. Because in a government hospital, it is very easy to do the biopsies. There's no charge for that, and patient will agree to find out their illness. No difficulty to get a renal biopsy.
What kind of
Because in
journals
private,
were there? Nephrology journals by then, international, or did you publish them in medicine
published
journals?
in national API journals, Association of Physicians
Okay.
of India journals, Kerala Medical Journal, and the Indian Journal of Nephrology. All these journals.
I,
So
I want to probe you on the tongue sign in uremia.
yeah,
What
yeah, yeah,
was
yeah.
I really want to hear that story, and I'm sure
Yeah,
it's very.
correct. See, clinical examination is very, very important in medicine. Now that part is already gone. Physical examination is
I,
very
I think it's a sorry reality in medicine.
yeah.
It's very
So
painful.
yeah,
I hope
physical
it
examination
comes
is
back.
very
I hope
yeah,
it comes back.
correct. Previously,
Mm.
when you go to an ordinary, a family doctor or a Vaidyan, they'll ask the patient to put out the tongue
Correct.
to see the pulse, then look at the eyes for the jaundice or you know or the hemoglobin, and ask the tongue to be seen. Tongue is a mirror of systemic disease. So I used to look at the tongue of the chronic kidney failure patients and found a very peculiar appearance in all of them. Tongue become large, and the serrations of the teeth will be on either side of the tongue, like a seesaw.
Mm-hmm.
It is very important suggestion. It's called a large plethoric tongue with the markings of the teeth on either side. It was there in 90% of chronic kidney disease. Once you dialyze them, urea creatinine is removed, tongue becomes normal. When you transplant, the tongue becomes normal. So
Oh,
that's what we call the tongue sign of chronic kidney disease.
oh,
That
I
is
think it's.
published. Yeah,
I think
published.
you should
published.
share a photo of one of your findings. We should
Yeah.
disseminate.
Another session, I'll get the photo.
We should
So
get
that is a tongue sign of chronic kidney disease, which is now being taught to the MBBS students on physical examination. But now many people do not want to know the physical thing. They want only the scan report and the blood report. So
Okay.
that period has gone.
And
So
when
that
was
was
this? Which year was this when you?
that's it's in the 1980s, 1990s. All
Okay.
these were published.
I think
So that was it.
that's anything that from as an anecdote that you'd like to share, beyond what we talked about, leptospirosis, snake bite, tongue sign, anything else that really stands out from in your memory in this space in pathology?
Because there's miracles happening in medical treatment even today. Miracles happening. We see patients who are about to die, but they don't die. The
Right.
doctor will say the certificate will have prepared, but they hail and hearty go back home. Like that, so
Right.
many episodes are there. Even the transplant scenario, where you find that patient has been very sick after transplant, you find next day onwards they start becoming better. It's beyond our imagination, beyond scientific experience. So the
Yeah, we're
miracles we have
always
seen.
humbled in this.
Yeah. So
I cannot agree more that medicine is very very humbling field. It
yeah.
happens more often than we
Yeah.
that it does.
Then
And
I gradually
your journey in starting the DM program, what
correct.
was that? Initial years?
DM course, of course, had to push the government as well as the university to start the department. And then the selection is all India. It was Kerala state selection, not all India selection like the moment. Kerala
Yeah.
state selection. And they could get one candidate a year for the course. And it was a 3-year course. And there was no problem because we had all the infrastructure and association of urologists, transplant going on, dialysis going on, very good library. What else a student want? Nothing. Enough and more patients. The government college, there is umpty number of patients are there for them to learn.
More than
There's
you
no
can
problem.
handle.
Yeah. So the DM course went on very well. First time in Kerala state at Calicut. Later on in Trivandrum, they started many years later. And Calicut that time was a mecca of kidney disease, mecca of kidney disease. Because urology your colleagues were excellent. Professor Roy Charlie, who started the transplant, and the urology PG course was already there in Calicut. So we were one step ahead of Trivandrum,
Kind of,
Kottayam.
you kind of complemented each other, right?
Yeah,
Urology and
correct.
that's, I
So
think
we could start very good thing so that it's an impetus for the other medical colleges start department there. I got trained from PGI. Next person who got trained from PGI is Dr. Kashi from Trivandrum. After 5 years, I passed. Then after 3 years, Dr. Ramdas got training. That means so many
we
years
lost
apart.
it.
Yeah.
Ramdas.
By the time we have established in Calicut, later on every other institution.
Every other was.
Yeah.
No,
Now
I
it is
think
a common thing to have a dialysis, transplant, everything very simple. But we
no,
have passed through a lot of problems to get into it, right? Thanks to
no,
Professor Chu, Professor Pai, and teachers.
no, but I
And
think you, Professor Kashi, and Professor
yeah,
Ramdas really took it up to the next level. And
correct.
Kerala State and South Zone have immensely
Right.
benefited by what
Right.
The high standards that each one of you set.
Right.
You're very fortunate.
Now,
I think I entered nephrology in the 90s. I came much later. But I think we still, I have interacted with all of you in all our meetings, and the quality
now
of
nephrology has further advanced. Now we have got women in nephrology also. Now a lot of ladies are becoming nephrologists.
It's really
We
growing.
have a women in nephrology, and this Sunday they are going to have a conference in Calicut. Women in nephrology. Yeah.
So you're going.
So advanced.
Are you a
Yeah, very
special
good.
invitee for the meeting, the WIN group?
Yeah, good.
Yes, I'm sure they'll be honored to have you there.
Right.
Then, if I guess it's quite trailblazing that the fact that you are the first nephrologist and all the first in nephrology in Kerala. And what was it about colleagues and collaborators as you transition through the field? I mean, is there
Yeah,
anything that you would like to share with us?
yeah, it
Colleagues,
was very good, very cordial because by nature I'm not a quarreling fellow. So
I'm well
I
aware
could
of that.
accommodate everybody and I could appreciate everybody. So they all like to, do associated with us, the surgeons, the physicians, and then the students. Then they got the inspiration to become nephrologists also. That's why we have got so many nephrologists in Kerala now. Every institution takes 3 people a year for the training, for the DM course or national board. So many people pass out nephrology in Kerala. Every year, I think 6 to 8 people pass out. So all hospitals now have nephrologists. All
I think for
hospitals.
you, I think for you, it is the 30, 40 years must have been a dream come true where nephrology has grown from
Yeah. This is
the
grown
humbling place where you did,
tremendous,
right?
tremendous. Yeah.
In a contemporary sense, with where we are in nephrology now,
Yeah.
the technology and every
Yeah.
therapeutics have all advanced so much.
Right.
Where do you see nephrology going now? Proteomics,
Yeah.
genomics,
Yeah.
monoclonals. How do you
Correct.
see nephrology if you are to see
Yeah,
that?
it is very good. Now we have gone on to the monoclonal as well as protein, as well as metabolomes. All these are very important in making especially genomes, finding out the genetics of the disease, genetics associated with transplant rejection. Yeah, all these are now already there. You can get everything done now. All investigations can be done, find out what it is. Now, newer and newer problems are coming like the face cream producing nephrotic syndrome,
Oh
different
yeah,
types of membranous diseases.
I
You know,
I had a
all
patient
these are
last week. Same thing.
yeah,
Face cream, nephrotic
yeah,
proteinuria.
yeah.
Mm.
Even today, I have got a patient with face cream and nephrotic. Today, we have done a biopsy for her.
No, I
So,
think my appeal to you on the show, maybe since you have experience in
yeah,
advocacy through the press,
right.
you should probably go to the press and say, about this whole renal link to face creams. It
Correct,
will
correct,
sound
correct,
more compelling than if some of us did. I think that's
right,
my appeal to you on the show.
right.
One other thing that maybe, what would you want an important stakeholder in kidney care in India, the government now? What would,
Yeah,
from the broad
yeah.
view, what do you think they would
Government has
focus?
done great deal now because they have made dialysis available in all the taluk hospitals, district hospitals, and the government medical college hospital. Free dialysis. Very
Yeah,
good of them. And they have made the transplant setup, disease donor transplantation, like the Chennai model has already come in Kerala.
yeah,
And
yeah,
we are able to get, it's only slow process, but it is already there. There's no difficulty.
yeah.
That is the best the government has done. And government gives some money to patients on dialysis, extra money. And then government gives free medicines for transplant patients. All the mycophenolate, tacrolimus is given free from the taluk hospital and the district hospital. That's a great thing which government can do. They are doing the best because now the people in the administration are knowledgeable people and they listen to the requests by the doctors and they accordingly they act and they produce good things for the public. The public because they want the votes, they want everything to be done for the public. That's the
From a
reason. It's a good
city
suggestion if they
perspective,
take it up. And the
from a city,
secretaries of the government are also very good. IAS people, they are people understanding. They make the ministry, the working order in perfect order. Very good.
I think the positivity in you is so overflowing.
No,
No, I
that's
was wanting to ask from a CKD perspective, do
yeah,
you feel that the government can do more for early stage CKD? Do you
yeah,
feel
yeah.
that?
CKD is on the increase now. CKD is
Hmm.
on the increase. Every, 1 out of 10 people has got a chronic kidney disease. Normal PEP. You see the normal. If you examine the urine or examine the ultrasound, you'll find abnormality in that. After the age of 45 or 50 years, some degree of chronic kidney disease already there in everybody. See, the world, the statistics is about 7% of the public has got chronic kidney disease after the age of 45, 50 years. It becomes 60 years, about 8 to 10% have got chronic kidney disease. They do not know. Now we have got a chronic kidney disease of unknown etiology.
Correct.
All
Yeah,
over.
that's
In
the
Kerala it is
challenge.
there, in Tamil Nadu is there, Andhra Pradesh is there, Telangana it is there. So we do not know how they develop chronic kidney disease. Leave alone
Yeah,
diabetics, yeah, leave alone hypertension. Now
yeah,
Kerala is the capital of diabetes. Kerala is capital of diabetes. Every
I
other
think
person is a diabetic. So they all have kidney problem. So you catch them early, make them understand about the validity of diet, for the validity of taking medication, and controlling the diabetes. Even now, even educated people do not know what is meant by control of diabetes. They
correct.
say if you take insulin, everything is okay, but the sugar is 250 fasting. They say I take insulin, there's no problem. I say, but
Side
that's
effect.
not sufficient. You have to be on a diet, you have to be on a strict
I think
medication follow.
I think
Yeah, that's
th-
important.
there's a lot needed on population education of
Yeah,
the general public on early kidney
yeah.
disease. Now, I want to probe your thoughts. In the modern world, we, as much as we are allopathic practitioners, Ayush is finding a very strong place,
Yeah,
in the real world.
yeah,
What are
yeah.
your thoughts around that? How do you kind of make both peacefully
Uh,
coexist? What are your thoughts around
it's a very difficult question and very difficult thing to do. The
that?
cooperation has to be there from both parties, and
Hmm.
some trials are, something like scientifically, because most of the other medications are not scientifically proved. We do not know what it contains.
Not with the
See,
structure that
yeah,
allopathic files are. Hmm.
correct. Of the allopathy medicines, you know what is the content. Whereas
Right.
Ayurvedic medicine, recently we had one patient who came with Landry-Guillain-Barré syndrome. And
Hmm.
then he had nephrotic syndrome also, and found out that the medicine which was taking by them contained mercury. See, most of the preparation they put lead, bismuth, gold, mercury for the quick relief of polyarthritis,
Whatever the symptom is.
yeah,
Right, right,
and low backache, but it produces problem for the kidney. So unless you definitely understand what is the medicine given by this, you know, other than allopathic medication, it's difficult. But for that, I don't think they agree very often. That's a problem.
right. Yes.
That's a
Yeah,
problem.
yeah. I
Actually,
think
collaborative thing is very good, excellent, because they have some good medication for the various disorders like the musculoskeletal as well as joint problems. But the ingredients nobody knows exactly what it is.
yeah.
That's the problem.
I cannot agree with you more that
Yeah,
sometimes even when patients come and ask, doctor, can I take that? I
right.
mean, we just do not know what it is,
Yeah,
which
correct.
also puts us at a position that you cannot say you don't take it because we don't know
Right,
whether it's good or bad.
right,
So I
right.
think
Yeah,
that's
but
what I
we
learned.
plainly say we do not know what they have. So same. That's the problem.
Yeah, I think it's quite challenging, but I really sincerely hope that we come into a more collaborative way of finding
Very good.
solutions for all the challenges
Yeah,
in India. I think I'm going to kind of take you to more lighter part of the show.
yeah,
Um, Looking back, I think your career is nothing short of stupendous. Inspiring is a very light word for it.
yeah.
It's what for any nephrologist dream in India. Would you have done anything differently? If you look back from 1972 to 2025, would you have done
Now,
anything differently?
uh, the professionalism is there, but the sympathy and empathy is gradually going away.
Okay.
That's the
Yeah,
thing which I understand. The
that,
patient
that is,
as such, you don't see the patient as a whole person. You see only as a kidney disease, only as a cardiac disease. That's the thing. The combined effect is not there.
you
The
feel
humane
that
approach is not there. Humane approach is not there. That has to come. And the whole
that,
human being is being treated. That also is not there. See, if the patient has got a headache, you get opinion from the neurologist. Then abdominal pain, get the gastroenterologist. It's true, but if the consultant feels that they have a problem which he cannot solve, you can get the consultation, cross consultation. But everything, if you get a cross consultation, it becomes a mess.
becomes.
It becomes a mess.
So,
You lose the confidence of the patient. You lose the confidence of the patient. You don't get a rapport with the patient and the family. That's very important medical treatment. A confidence of the patient with the doctor. The doctor is unable to decipher what the illness, what is the purpose. See, that's the problem. The doctor-patient relationship is gradually going away. That's why all the cases and all this come into the picture, riots and then hospital damage and all these things. The rapport is being lost in this new world of training. That is lost.
I think the trust and the connectivity, I think it's the trust and the rapport which spills over.
The more specialized you are, the more rapport you should have.
Yeah.
The more you are seeing the more things from the little things, but the more should be the rapport with the patient. That's very important.
Absolutely. I cannot agree more. I think 2 more questions before we kind of close the show. I know when we were planning the show, you talked about a book that you were working on. So where are you with the book?
Book is already completed and published in Malayalam. I am in the process. So I already published in December 22nd is the release.
What is the title?
Kerala. All over in Kerala it is there.
What is the title of the book?
Title of the book is Ende Jeevitham. That is my life. Okay. My life in fullness, in his fullness. That's the title. My life in his fullness. So that's the book. That's I'm doing that translation to English, and within a month's time the translation will be over. Then we get it published from English to the other parts of the country. That's already in the process.
I think I should do
nobody has written an autobiography of renal disease doctor so far. Other than, I think, our Georgie in Chennai, he has written about his rapport with the patient. He said, my patient is my God. And Dr. Mani has written a book.
Yamaraja's.
Yamarajas. So those 2 books are published.
Okay.
Yeah. But I have written a full biography from my school age to the nephrologist, then the training, then what the future is waiting for us, what the future nephrologist should do. All these things are there in the book.
I think we'll do a show only on the book.
You will read Malayalam?
I don't read Malayalam. I can understand Malayalam, but I'm not read
Malayalam. You can't
read
it. So when I get the English translation, I send over to you.
No, but I think we'll do a show only on the book with you after I read the book. We'll have a book club on this thing.
Right.
But I think that I'm sure. How long did the project take? I mean, the whole writing the book.
Book about 1.5 years. 1.5 years. We have to edit and re-edit and all that. And it has to be from a spoken word to a real book language. With the help of 2-3 people, I got it done.
Do you have a lot of photos in the book that?
Some very important photos of school, as well as PGI, the Trivandrum Medical College, and all such photographs are there.
I think the last question is probably your favorite. I think there are a lot of nephrologists, there are senior nephrologists, nephrologists who may have written books, but I think you are unique that you have a genetic contribution that has a legacy in nephrology, which is your son and daughter.
Yeah,
I personally know them before I was a professional, but I want you to say, how did they walk into this field?
Correct.
Maybe
the thing is,
them, and was it your push or the pull of nephrology? What was it?
Yeah, I think we have never spoken about kidney disease in the house.
You should tell them on the show. I think
so they have seen what is happening and how I was working. So we have never told them to take up medicine or nephrology or anything. It's their choice. Seeing their father, how he was working, how he was interested in patients, how he spent all time for patient care. That only was impetuous. That's what I understand. And so they have got that information from what they saw rather than what we spoke to them. We never said about medicine or nephrology to both of them, but they took and they passed and they are doing well. So I'm happy about it. And now,
I think just for the show, I think I should formally at least mention their names. Professor Mathew's son is Jayant Mathew.
Dr. Jayant Thomas Mathew, and the daughter is Anila Abraham Kurian. Anila. Her husband is a transplant surgeon in Chennai.
Yeah.
He's Dr. Abraham Kurian in SRM and
he's
Triple M. Yeah, Triple M. He's a transplant surgeon. So I do not know how everybody got into nephrology, including the in-laws. Do not know. It's only God's plan. God has got a plan for everybody. I believe in that.
Yeah, it's a very grand
God
plan.
has got a
It's a
plan
very
for
grand
everybody.
plan for, I think God made a plan for whole of
Correct.
nephrology in South
Correct,
India.
correct,
And I think I should especially mention Anila because it's somebody whom I
Yeah.
work very closely with,
Correct.
and she's
Correct.
a phenomenal nepropathologist whose wisdom and knowledge we deeply rely on all our biopsies. I think I should personally thank you for your genetic contribution to nephrology in my life.
So I always believe that we all have, we have been destined to do that even before we are born.
Absolutely.
Destined to do this.
I can't agree
And
more.
get the support from the family. My wife, she prays for the patients every day. Prays for the transplant patient who is going for transplant today, patients who are being dialyzed today. Every day she prays, That's a very strong, support from the family, without which we can't do. Every day praying for the patient whom she has not seen. See, if I say there's a transplant today, same day she prays for the well-being of the patient, and the transplant surgeons, they should do properly without any problem. That's the strength which we have. So I strongly believe in God's decision about each person. That's what I said. It's all decided. I never knew that Anila would get married to a transplant surgeon. So it's God's plan. We can't. Our life is God's plan, and we are destined to do this and that. So life's plan. Your friendship is also planned from the God's vision. Otherwise, how can I come to podcast along with you? It's all planned even before.
I agree. Any other closing words, Professor Mathew, before we close the show? Any words from you?
Nothing. When is your program to Calicut? You should come one day.
I'm sure I will. I'm going to come with Jayant.
Yes.
I think the last time I was there for the ISN conference. In fact, Srilata, I'm sure you're one
I
of
conducted a national conference here in 1995. National conference in Calicut. There was a great occasion for the National Indian Society of Nephrology annual conference here in Calicut. That was in 1995. It's a big gathering, very good. So many people came, and it was very nice. So thank you very much for the questions and the answers. Hope you agreed what I said.
No, I think before closing the show, I think personally what I would say is more than a pleasure. I think it's an honor.
I think time is over, no?
No, there's no time. No, it's time is when we say it's time. No, I think personally, I should tell you more than a pleasure. It's an honor to have listened in your own words, your entire life story from why you chose nephrology, when you chose nephrology, to the phenomenal journey. Thank you, sir. And to all of those who have tuned in, thanks for tuning in, and watch the present and the past shows on our YouTube channel. And you can find our link on our Insta pages and our social media pages. And thank you.